hope you have started practicing the PNF exercise for diabetes. Diabetes is the increased level of blood sugar. Sugar or glucose is our body's main source of energy. So when you do exercises like walking, glucose is utilized by our muscles. Over time, it can lower the blood sugar level. Then why PNF? What do you mean by PNF exercise? What are the benefits of doing PNF? PNF means proprioceptive neuromuscular facilitation. That means facilitating the nerves and muscles through stimulating proprioception. Proprioception is a sense of self, movement and body position. Just like other organs in our body, blood glucose is the main source of energy for our brain cells also. 20% of our blood sugar is utilized by our brain cells, which is, when compared with other organs, pretty good amount because brain weighs only 2% of our total body weight. That is 5.6 milligram of glucose per 100 gram of brain tissue per minute is utilized, and brain needs continuous supply of glucose. Brain uses around 350 to 450 calories per day in an average man or woman. So when we facilitate the brain cells along with the muscle, it utilizes more glucose, thereby lowering the blood sugar level. Aerobic exercises and resistance exercises are also beneficial to the diabetic patients. But when we increase the intensity to lower the blood sugar level further, it may lead to hypoglycemia, so that the patient may not be able to enjoy the benefits of doing exercises. But we concentrate more on PNF exercises, which facilitates the brain cells. We can lower or control the blood sugar level without any symptoms of hypoglycemia like sweating, pounding of heart, dizziness, giddiness, etc. So the patients will get maximum benefit out of the exercise. Hence, doing PNF exercise is the better option. Other than this, PNF exercise comes with a lot of other benefits, like it improves the sensation of lower extremities. You know that in case of diabetic neuropathic patients, there will be loss of sensation in legs that can lead to so many complications. So when you do the PNF exercises, it improves the sensation, and also it improves the muscle strength and flexibility. PNF exercise improves the ROM, that is the range of motion. I already told you that there are some conditions like periarthritis shoulder or frozen shoulder, which is common for diabetic patients. In those conditions, there will be restriction of joint. So when you do the PNF exercises, it improves the range of motion and it improves the endurance. Above all these, PNF exercises are pretty simple exercises to master and inexpensive. Thanks for watching. Consistent scientific practices for persistent recovery from diabetes.